There have been mounting calls on government to place farmers and farm workers in the essential services category so that they can receive COVID-19 vaccines early. Now farmers and farm workers in Mpumalanga are being prioritized. eNCA's Khayelihle Khumalo is in the province where the health officials are on an oversight visit to ensure that farm workers in particular get the vaccine. Let's talk to him now. He is in Amsterdam and he made the point off air to tell me that it's not Amsterdam in the Netherlands. And I know that, Khaya, because that's my neck of the woods there in Mpumalanga. Just tell me about the initiative that is being undertaken. You don't immediately think of farm settings, as being congregant settings where, many people congregate. But farm work, the work on farms, is essential in as far as the food supply is concerned.
Well, that's right, Caesar. The issue around food security is very central, and we do know that the agriculture sector plays quite a very pivotal role in that regard. So hence now they are prioritizing the farm workers as well to get a jab. So I can tell you this much, we have been interacting with the farm workers. There is a great deal of excitement, and predominantly this is one of the provinces where agriculture is quite a very important sector. And joining us now, Caesar, is the Premier of the province here. So Premier, thank you so much indeed for your time. So you have been engaging with so many sectors, and today it's quite a very important day because it's a turning point. You are here with the most vulnerable workers, the farm workers. Maybe just give us a context behind the issue of making sure that the farm workers as well are included into the vaccination drive.
Certainly, as Mpumalanga, as we know, we are a rural province, and predominantly agriculture is one of the sectors that is quite prevalent in terms of economic spin-off. And therefore, it is in our interest to make sure that our farm workers, and including their families, and taking into cognizance the fact that they stay in remote areas where it is quite difficult for them to access healthcare services. And if they had that opportunity, when you look at the time when they knock off from work, it is almost difficult for them to reach to our health facilities, not only health facilities, but other amenities as well for assistance. And it is for that reason why we came here precisely to say we will mobilize them within their easy reach, where we can access them with the reach without them having to travel long distances. And therefore, to us, it is very important to keep them healthy, because as we do that, that will not have a negative impact in terms of productivity. And therefore, it was very crucial that we come closer to where they are, and we are quite happy with the turnout that we have seen amongst them, and they're looking forward to take their jab. We are giving them a J&J because we don't want them to a reputation thereof, and therefore it is good that they have it once, and we know that we are done with them. As you can see, we've got quite a number of them who came out, and we're encouraging them as well to say these facilities will still be available for their family members that are not farm workers but who are residing along these areas, to visit the very same site where they can also access jab with ease. And we are delighted by the progress that we are seeing this far. And as a province, ever since we started, we can indicate that to date, we have already vaccinated about 412,000 people. And to us, that number, we think there's a lot that we can still do in terms of improving that number. However, it is also affected by the reluctancy, in particular amongst the males within our province. We find it very difficult to convince them to go out and get their jab. As you can see, when you walk into the station, in the main, those whose high blights are high are males, because they are scared, But what I like about it, afterwards, they get back to their senses and they feel like, no, but we're scared of nothing. There's nothing wrong with this injection. And we hope that message will go out there within our communities so that they feel at ease to get their jabs.
And Madam Premier, how is it like engaging with the farming community? We know at times is, always resistance at times, but would you characterize it as something that was great in terms of cooperation with these sectors as you're forging all these synergies with all these key sectors?
Well, our farmers around Mpumalanga, in the main, in this regard, they are agreeing with us and they are cooperating. And not only just that, but they have also had initiative. If we were to cite, like SAFCOL, they have partnered with us in building one of the clinics within the nearby community where they are operating. So that to us, it's a sign of them being willing to reach out to our people in making sure that they give them easy access to facilities that they need the most. And therefore, we are grateful by those initiatives that they are also out of their own accord in collaboration and partnering with government to make sure that we assist and we work together in making sure we expand within our communities.
And just before I let you go, Madam Premier, the issue around the vaccination sites in Mpumalanga, I would imagine that one of the priorities that you are factoring in is around the expansion of those facilities. So far, just give us a breakdown as to how's your province doing on that score.
Well, we started off by 110 sites that we have established, but for the past 2 weeks, we have been initiating other sites where we could reach our people with ease. We went to the taxi ranks we have stationed there, and ever since we have stationed there, we can see the number are gradually improving, and we are targeting the private sectors, utilizing their facilities as well. So the more we increase on our sites, the better for people to have access to vaccination. So we are strategically looking at areas where most of our people are, and we zoom into those spaces. And the next move that we want to do, as the president is gradually opening up the country in terms of the levels, we will be targeting very soon at the malls, shopping centers, where we find by and large most of the people going out for shopping over the weekends. We'll be mobilizing them over the weekends and talk to them to get their jab. Those who are willing will certainly do that. And what is good about it, you don't have to register prior. So you can there and there register and immediately get your jab. So you don't have to wait for days for approval now. So that has since assisted as well to fast track the vaccination process.
All right, Madam Premier, thank you so much indeed for your time, and all the best as you undertake what is a very colossal task as we face COVID-19. So Mpumalanga says it really wants to make strides in terms of fighting this pandemic, and today it's the turn of the farm workers, and you can see that there's a great deal of enthusiasm. They're so excited to be here to receive a jab, especially because with J&J it's purely just one shot, and they don't have to come back here.
Yeah, absolutely. And that's part of the messaging that has been coming from government, that they will prefer the J&J shot for the more rural areas of the country, because it means that people just go once and it's done. The logistics of managing it, as well as the temperatures at which it's supposed to be kept, actually make it more suitable for those kinds of settings.